Okay, so we're gonna continue the lecture. So the cells, they make tissues, and tissues, you mix them up, and then that makes organs. And then you can mix up the organs, and that'll give you organ systems. So for example, we'll talk about cardiovascular system, urinary system. So you got all these blood vessels, and you got the organs, and you got all these capillaries. You combine everything, and that gives you an organ system. And then we break them down into, skeleton system or muscular system, nervous system, and so forth. So in this course, you're going to cover every single one of them. So this is kind of your table of contents here. And we are going to cover some of them in a little bit more detail. For example, the vascular system is going to be broken into multiple chapters because there's so much stuff to cover. And on the other hand, something like maybe integumentary system, we may only have one chapter on that, so probably spend only one lecture on that. So let's just say that we're going to cover most of the human body in terms of scale. So you'll start from the small scale and then go to the larger scale. So this is the reason we ask you guys to take general biology, because we're going to skip some of the stuff in terms of basically when it's getting to the larger and larger level. So what I mean by that is in terms of atoms and molecules, those are going to be covered, but we're focusing mostly on the cells and tissues and organs, and then the organ level system. But in general biology, you would go beyond that. So you would go, you have obviously you have the atoms and molecules, and you have cellular level, tissue level, organ level. But beyond that, you have populations after, organisms. Organisms make population, and populations make ecosystems, and then the community, and then you get into the, the biosphere. So but here we are going to basically stay in the realm of cellular to the organ system. So basically it's going to give you an idea what you're going to get into if you look at all these different systems, because that's where this course is focused. Now we have language of anatomy. This is used for communication purposes. Why can't we just use the regular English? Well, we can't just use the regular English because the terminology is something that needs to be known by all the working healthcare professionals. If somebody's performing a surgery and they're saying, oh, make a cut here at this specific spot, maybe at the midline of something, then the other person needs to know, what they're talking about. So there's this one language of anatomy, that everybody, all the healthcare professionals know. So when they talk about something, they know what the other person is referring to. But in English dictionary, we have the same word. They might have multiple definitions, but in anatomy, that word has one definition. So, like I said, let's say you're working in a hospital or emergency room, or in some kind of a situation where you need to communicate to somebody, or you need to tell them, um, you know, um, that maybe make a incision from medial to lateral, so they know what you're talking about, which direction you need to go in. So that's the reason we need anatomy, because it's basically a language that's very precise. So what I'll do right now is I'll go ahead and get you started with some of the terminology in anatomy. And then it comes from Latin and Greek. So most anatomical terms come from Latin and Greek language. So we're going to continue this in the lab by having you do some worksheets and do some exercises. The first thing you need to know about anatomy is that we talk about the human body in this thing called the anatomical position. Very important that you need to know what anatomical position is. So it's very important. In fact, everything kind of revolves around this. So you're going to say, um, okay, so the front of the body or the rear of the body, or, if you're looking at the superior view, or, um, you know, those terms, they don't mean anything unless somebody's standing in the anatomical position. So what that is, basically, you're standing, you both your feet down. So humans, they walk on 2 feet. So we're not like other animals where they walk on 4 feet. So we walk on 2 feet. Our body's in a different position compared to a dog or a cat or an elephant. So, in anatomical position, first you need to be standing flat on the ground. So your 2 feet are flat on the ground. And then the first thing, in the next thing in anatomical position is your hands or palms are facing forward. So your palms are facing forward, and um, in this case, they say the hands are on the side, but they're facing forward. So that's the anatomical position, and this will hold true even if you're laying down. So if you're laying down, or a patient is laying down on the bed or on a gurney, you're looking or talking, maybe we're talking about cadaver, you're going to be using the terminology if the patient or the cadaver were in standing with their feet flat on the ground and the hands on the side and the palms facing forward, or um, so that they're still in anatomical position. So again, standing with the feet flat on the ground, the hands are at the side, the palms are facing forward anterior. That's the anatomical position. And this is coming from Leonardo da Vinci. So if you go on Google and search Leonardo da Vinci man, you're going to get a bunch of anatomical drawings. So he was he was one of the foremost anatomists, not from our time, but he was alive 500 years ago. His drawings are so anatomically correct that, it's some of the drawings that you find in some of the textbooks today, not all of them. He didn't get everything right. And also he didn't have the technology or lighting that we have today. But it's amazing what he was able to accomplish with what we had. Okay, so if this is the position, then what do you call it when somebody's laying down? If you're laying down and you're facing upwards, this is called being in a supine position. Supine position means you're facing up. So you can use that to describe the palm of your hand if your palm of your hand is facing up. So that's supine. If you take palm of your hand and you flip it over, then it's going to be in the prone position. So this is going to be really important for especially people who are in physical therapy. So if you're reading your textbook or your instructions, take, um, let's say take your patient, take your client, put them in a supine position, grab their forearm, do this or do that. Well, that's anatomical terminology, and it's going to be very useful later on if you continue to stay in the health field. The way that anatomists remember which is which. So if you hold a bowl of soup, BOWL, bowl of soup, um, and that's going to be in the supine position because your palms are up. So you're holding a bowl of soup. Soup is for supine, and the supine position, and the opposite would be prone position. So I'm just going to keep throwing these, in there, just in kind of tips and tricks for how to remember things. So the difficulty in learning anatomies is not about just sitting there and memorizing it. It's about, trying to find shortcuts. So if you got a person in anatomical position, remember that their feet flat on the ground off to the side, and then the palms, arms are off to the side and the palms are facing forward. So now we got a person that's, in this position, and then we're talking about anything specific, that's the position we're thinking about, the anatomical position. So again, supine is laying down, face up in anatomical position, prone is laying down, face down in anatomical position. Okay, so let's see. So let's see. So we draw imaginary line here. So that's anything above this line is going to be superior, and then anything below that line is going to be inferior. So you might have heard about this big blood vessel called inferior or superior vena cava, or the inferior vena cava. So that refers to the blood vessel that's coming off the heart. So let's say this is the heart, and the part that's coming off in the top or going up or above, that's the superior vena cava, and the one that's going to be supplying blood from below the heart, that's going to be inferior vena cava. So in this case, basically, you need to pick a landmark, and anything above, for example, this imaginary line is going to be, anything above the landmark is going to be superior to it. Anything below the landmark is going to be inferior to it. So now, compared to animals, that there's a really stark difference in the terminology, anterior and posterior. So let me see. There we go. So anterior versus posterior. And so anterior basically means the front. So let me type that for you. So it means front, and then posterior means back. So anterior means the front of the people. So that basically means your feet, sorry, your face, your chest, your belly, and things in that sort of. Posterior means back. So back of the people. So of a person. So posterior means your back, your basically behind of your legs, your buttocks, your calves. So things of that sort. It's not the same when you look at other animals that so let me see if I can maybe draw that for you. So let's say I have an animal here. That's the tail, and that's the head, and maybe four legs. Some, you know, so when we are looking at an animal, I don't know which animal this is. Just, an animal that has four legs. So let's say those are the legs, and so this is the front. This is where anterior is going to be, and this is where posterior is going to be. So the anterior is towards the head, and posterior would be towards the tail, which is not the same for the humans. Humans, the anterior, we're standing on 2 feet. The anterior refers to our belly. So over here, this cat and or the dog is actually pointing way downwards because that's where their belly is. And it's not front of the head. The head is pointed up here, it's anterior, the tail is posterior, and our head basically is our head or our belly is referring to the anterior or ventral. Ventral stands for belly, and dorsal stands for the back. Dorsal stands for the back in humans. Anterior is the same as ventral, and posterior is same as dorsal. So dorsal stands for the back in humans, and anterior stands for the front. Another thing I want to mention is also draw this for you. So here's the tail. As I mentioned, is a dog or a cat. And then that's the posterior, and the head is anterior here, but the belly is down here and the back is up here. So you have to understand the anterior or ventral. Anterior is ventral and posterior is dorsal. It's completely different in humans compared to other animals, because we're able to walk on 2 feet. And I know that was complicated, but it's really important that you get that, because I'll be using the word anterior and posterior in almost every lecture. So if we're talking about ventral and dorsal, dorsal is going to be up here, and then the ventral is going to be here, because that's where the belly is. So it's completely different animals, but since we're talking about humans, so just make sure you use human figure for reference. Okay, so now let's see. Now I'm going to go ahead and draw a line um, down the middle of the body. So just imagine this is, completely in the middle. So if you draw a line down the body, that's anything that's away from this line is lateral, and anything that's near this line is medial. So maybe your heart is going to be medial to this line compared to anything that's maybe right here, maybe the arm. So anything that's near the line is medial compared to anything that's away from the line. And so anything that's away from the line is called lateral. So we're building up a vocabulary now. So I'm basically giving you new words as we are going. So we have another term, and that's called superficial and deep. So you can't really see this in the image, but pretend that let's say, talk about your skin. Let's say, maybe when you're touching your skin, that's superficial, but when you cut into the skin with a knife, it will go from superficial to deep. So when you go from superficial layer of the skin towards the deep, that's when you get to the muscle tissue. So there'll be blood vessels, there'll be muscle, so all sort of other things in the deep direction compared to the superficial direction. And then let's say you got this arm and it's connected to something here. So the part of the arm that's connected to the torso here is proximal compared to the part that's away from the torso. So this part is proximal to the body, and this part is distal to the body. So for example, let me see, I'm going to draw the uterus. Here is the uterus. And then you have your fallopian tubes. So the part that's away from the uterus is going to be called the distal part. So this is going to be distal here. Compared to the part that's close to the uterus, this is proximal. This part is going to be proximal compared to this part here, the ovaries. And same thing, you'll find your kidneys and so forth. So it's really important you write down these words right now and start memorizing them, because it's almost like you're taking or you're learning a new language. Maybe you're taking Spanish or French or Chinese. You need to just start jotting down the vocabulary words and memorizing them. Otherwise, you're not going to be able to do well in the anatomy class. And it's really important that you start memorizing these terms. So we have this is a picture from the textbook. So your textbook has everything I mentioned, but they describe it in a little bit uh, differently. So you have proximal, which is connected away from the body, or it says attached away from attached base. So that's distal. It says towards an attached base. That's proximal. So the shoulder is proximal to the wrist. That's an example. Now you look at a person from the side view. So again, the back is called posterior or dorsal, and the front is called anterior or ventral. Again, this is not the same in other organisms. So towards the head, you can say, the head part is referred as cranial or cephalic. And anything regarding the head, you might see the word cephalic next to it. But that would be anterior in a cat or a fish. So for us, anterior is our belly towards the head is going to be called cranial or cephalic. We don't have a tail, but if we did, then that's going towards something called caudal, towards the tail. So the caudal word stands for the tail. If you know anything about fish, the tail fin is called the caudal fin in fish. So for our ancestors used to have a tail, and it has pretty much disappeared now. It's turned into something called the coccyx in humans. or tailbone. So if you're going in that direction, that's considered to be going towards caudal direction. Next, we have body plane. So I'm going to do a different video on this. So I'm going to continue this in a different video.